stabbing, shooting, splitting, right? These are all words that could be describing the painful headache that you just can't kick. But today we are bringing you the biggest advances to stop your chronic headache pain. Joining me is neurologist and headache expert, Dr. Audrey Halpern, who knows all things about headaches. So first of all, what are the biggest triggers we got to worry about?
Well, migraine triggers vary from person to person, but the most common migraine triggers are things like weather changes, stress, lack of sleep, sometimes different types of lighting or smells, alcohol, lack of caffeine, and sometimes even skipping meals.
So if someone's thoughtfully, and I'm sure they always are because people with migraines suffer terribly, looking at all the options, what have they already tried before they come to see you? What works at home?
Most of my patients have already tried things like hydration, different dietary changes, certainly over-the-counter medications, and many of them have even tried prescription medications that are either ineffective or may have side effects that they don't like.
Yeah, I got so many notes about this. I get it, guys. Chronic headaches are debilitating. They ruin your plans. They interfere with work. They isolate you because who wants to be around a person with a headache, right? You don't want to be around them. That's why we search far and wide for the best new advances that may stop this chronic pain once and for all. Come on over. Because first up are these cool headache wearables or neuromodulation devices. If you could explain what a headache wearable is and then walk me through a couple.
Well, headache wearables are really the newest, one of the newest migraine treatments available, and they're all called neuromodulation devices. They all provide electrical stimulation in a variety of different ways that help to interrupt the migraine pain pathways. There are 3 that are FDA approved: CEFALY, Gammacore, and Nerivio, and all of those 3 actually have good clinical trials showing their efficacy with little to no side effects.
Show me just if you don't mind. So they're studying energy through your brain, changing how the blood vessels, I guess, are opening or closing, or the nerves sense the blood vessels. Is that what it's doing?
Yeah, so they change the way nerve impulses are going through your nervous system.
Got it. So one of them I noticed top in the forehead.
This is the CEFALY device, and CEFALY is a nerve stimulator that you place on your forehead, and it's a supraorbital nerve stimulator. So it stimulates the nerves right above your eyebrows. And when it stimulates the nerves, it interrupts the pain signals.
Okay. So when someone sees you in your office, how do you know whether to recommend that they get one of these devices?
Well, there are a variety of different features to the devices and different features to the patient's pain that may direct you to one or the other. Some of them, such as the CEFALY, can be used for migraine prevention as well as for acute migraine relief. So in someone who needs prevention, we may use that.